Hey, CFMA, why should my company put naloxone on workplaces and job sites? I'm Beyer. I'm the Senior Director for Safe Workplaces for a national nonprofit known as SAFE Project, Stop the Addiction Fatality Epidemic. Many of you will know me through my work with CFMA to launch the Mental Health and Suicide Prevention Initiative. But for many years, I've been waging a counterattack against opioids in the workplace, teaching people how to take care of their families at home. Naloxone is also known as Narcan. It is an opioid antagonist. It's designed to reverse the effects of opioids. In the case of an accidental, unintentional overdose, administering naloxone can reverse the effects and restore someone's breathing and be transported off your job site or your work site and hopefully be a saved life. The reason this is important is construction is our industry has the highest rate of overdose of all 20 major industry groups that were studied. The rate for construction and extraction combined was 162.6 per 100,000 workers. In construction at the occupation level, the rate was 130.9 per 100,000. And for mining, it was 60.9. This shows a need to be prepared for accidental overdoses in the job or work site. Concerning is the Bureau of Labor Statistics for 10 consecutive years has shown an increase in the number of overdose deaths as occupational fatalities. That number's risen 10 consecutive years and is now 9.5% of all occupational fatalities. That hasn't been done for construction, but with our industry having the highest rate, it's logical that we would have a very high rate if that study was done. So what many contractors are doing is providing Narcan in the workplace and on job sites in the event of an accidental overdose. That's the argument for why this is necessary. I will do a second video at a later date on the signs and symptoms and how to administer naloxone on a job site. But this is an opportunity for construction leaders to break the stigma, to be prepared, and it's a powerful risk management strategy. If you have naloxone on site and you have trained staff and it's part of your emergency response protocol, you could save a life. The alternative would be if you don't, and a person is not revived because no one on the job site has Narcan. Even if you call 911, that person could be deceased. Brain activity can stop in as little as 4 minutes. And if we don't have a proper response to restore breathing, that person could die. Now you have EMS and law enforcement coming on site. You may have a coroner. You could have an OSHA agency coming on site to do an investigation. But more importantly, all other workers on that job site are going to question, why didn't you have naloxone on your workplace or in your job site to protect that worker? Conversely, from a risk management standpoint, if you successfully administer Narcan, that person is successfully revived, transported by EMS off your job site. When someone calls later, maybe social media or someone from the media, to ask, did you have a medical emergency? Yes, we did. We're happy to report he was transported off site. It's no longer your concern, and your employees are going to recognize that you were prepared and ready, and then together you saved a life. That's why I believe naloxone on a job site and in the workplace is the next important frontier in workplace mental health. Please learn about the risks of opioids, learn how to protect your workers and your families. And if you are aware of anyone that needs naloxone and doesn't know how to get it, please reach out to me. I will offer you guidance. Thank you very much for your support. Let's go save lives.